Okay, folks, it's 2:30 and it's time for us to begin. So I do apologise to anybody that thought it was 2 o'clock and got here really, really early. Um, but good afternoon and welcome to the first Health and Wellbeing Board of the municipal year. Before we start these proceedings, may I bring to your attention some housekeeping matters. We don't expect a fire alarm test today, so if the fire alarm sounds, please follow the fire and emergency procedures that are applicable to the council house, which is basically out the front door, across the other side of the car park. Mind you, that's a bit difficult now because there's Harris fencing there and a building site, so I'm presuming there is an alternative, but I'm sure our guy at the front will be able to tell us which one it is. The meeting will be broadcast live to the internet and will be capable of subsequent repeated viewing by entering the Warspite room, and during the course of the meeting you're consenting to being filmed and the use of those recordings for webcasting. Can I ask that you speak clearly and directly into your microphone when addressing the meeting so that online participants and the public can hear, and that you switch it off when you're not using it, and that all your mobile devices are turned to silent, please. Now, I need to note the appointment of Councillor Mary Aspinall as chair, and I believe that John Mahoney was appointed vice chair for the municipal year, but I don't think we can confirm that bit of it because John's not present. So if he joins us later, we can just sort of skip back to that if needs be. So can I have a proposer that we appoint Mary Aspinall chair for the year, please? Thank you, Jemima, and Tony, thank you for seconding it. And can I have a vote, please, folks? All those in favour? Excellent, thank you very much indeed. Right, so have we had any apologies, please, Elliot?
Yes, thank you, Chair. Apologies from Councillor Charlotte Carlisle. Councillor Salmon is substituting today. Apologies from Sharon Muldoon, Director of Children's Services. Apologies from Anna Coles. Gary Wallbridge will be deputising today. And Councillor Mahoney will be arriving late. Thank you.
Thank you very much indeed. Now, what I'm going to do, because it's the first meeting of the year, I think it would be reasonable to go around the table and introduce, because this is one of those meetings of two parts. We've got a core membership and then we've got additional members. So if anybody's confused as to which bit they are, then we can clarify that at the same time. So, David, you're the nearest one to me there in that respect, so will you start, please?
Hi, I'm Councillor David Salmon for Dunstone, and I am totally confused, so I'm not sure which side of it I'm on, but I'm standing at the moment for Charlotte.
You're a member, so that's all right. Yeah.
I'm Councillor Jemima Lang. I'm Deputy Leader of the Council. I'm also Cabinet Member for Children's Social Care, and I'm a member. Thank you.
And it's Gary Wallbridge, so I'm deputising for Anna Coles today, but I'm the Council's Head for Adult Social Care, and Anna's a member. Sorry.
I'm Chris Morley. I'm the Interim Locality Director for Plymouth for NHS Devon ICB, and I think I'm a member too.
Tony Gravett, Manager, Healthwatch Plymouth and Systems and Intelligence Lead for Healthwatch Plymouth, Devon and Torbay, and I am a member.
Laura.
Hello, I'm Laura Bowater and I'm the current head of the Peninsula Medical School, and I don't think I'm a member.
Just for clarification, University of Plymouth are an additional member.
Thank you. Rob?
Yeah, so I'm Rob Nelder, consultant in public health with Plymouth City Council. I'm not a member. I'm literally here today just to present the item on the Health and Wellbeing Board. So I'm sort of sat here rather than to listen in, rather than jump in and out at the appropriate time for that one. So thank you.
We'd hate for you to be a jack in a box jumping around then. Ruth.
Hi, yes, I'm Ruth Harrell, Director of Public Health, and I'm a member.
And last but not least, David.
Yeah, hi, good afternoon, everyone. David Jones. I'm a Plymouth GP, but I'm here as locality clinical lead within Devon ICB, working closely with Chris Morley, who's, my apologies, I can't be there in person today.
Welcome everybody, and Elliot, do you just want to say hello to everybody who might not know you?
Hi everyone, I'm Elliot Werngold, I'm a Democratic Advisor and I clerk Health and Wellbeing Board.
Thanks very much. So move on now and ask anybody got any declarations of interest in regards of today's agenda? No, right, we can note that. Thank you very much. Now I've got a bit of Chair's urgent business. This makes a great change, I'll tell you this. And I think, Elliot, are we going to pass around those? On Tuesday even, I attended the Health and Adult Social Care Scrutiny Committee, and one of the items they had for business was a report that Ruth had put together about the defibrillator motion on notice that came to us. Oh, I've got to say, back in March, I think it is, as a council, and it was really, really interesting to see what came out of that report. And Ruth, your report was very, very clear, and it was saying about the number of sites that we already had as a council and we knew of, and that they identified some that were high risk, and we were looking to recommend some defibrillators. And it was rather coincidental that when I got home that evening, there was an email that had come to me via the leader's PA and Tracy's PA. It was from a government minister saying that they really wanted us to be progressing something that is known as the circuit, which is a national defibrillator network, which means that it's the defibrillator site is notified to the ambulance control, so that when a member of the public goes up needing to use that defibrillator, they're given a code so they can unlock it, and whatever. So, and I think that's a really, really essential thing. So, as I say, it was rather providential that that had come. So during the conversation that we had within the scrutiny committee, and David, you were there as well as me at that meeting, and it was quite fascinating that there were some recommendations and then there's going to have to be some negotiation. And I think I need to take the recommendations that came out of that meeting rather than the negotiation, but the negotiation needs to be had behind the scenes, and I think about venues, etc. And I think we probably need to put something out to all councillors and all organisations that are represented within the community that they need to think very carefully about whether they are able to cite a defib, whether they can fund it, because council isn't going to be in a position to be able to fund everything. But I think we need to think about how do we manage it, how do we get that map going, how do we make sure that people are within distance of a defibrillator if they need it. But on the other hand, it's making sure that they're in venues that are useful rather than tucked away somewhere. I mean, Pauline mentioned that her and her other two ward colleagues had financed a defib that had ended up in a cupboard somewhere in Efford, and I think we need to sort that out. So what I'm going to ask you to do, you've been given the recommendations that came out of that meeting, so I want to discuss the recommendations that are coming to the Health and Wellbeing Board rather than the others that we as a council will take forward, the citing of the 2 at the libraries and the 5 other ones. That I think, let's leave that's a council issue, but it's coming and asking you to have a discussion now about we promote a Restart a Heart Day on somewhere about the 16th of October each year, that we work to promote CPR training, and again that needs to be in varying venues. It's not something that we can all say everybody come in. I mean, these tables might be quite useful for doing a course on, rather than having to get down on the floor. But you know, I think we all our organisations need to think, how are we going to help contribute to that? And again, it comes back that third one they're saying is all defibrillator owners across Plymouth are encouraged to register their defibrillators on the circuit. And that all defibrillator owners across Plymouth suitable for public access, and that's what we have to remember, some won't be suitable, should consider whether access should be widened 24/7 if they're not already. And again, that's where we all have to think about what's accessible and what's not. And that PCC should promote schemes to access funding for publicly accessible defibrillators amongst communities, and that PCC work with partners to provide the defibrillators at St Budo Library and Southway Library. And I think I would put a proviso on that to say, and any other appropriate library sites. And I think that's what we have to think about, is where, because it's not much point putting one in one library when 2 yards down the road there's a publicly placed one. So I think we have to, David, that's, you know, and I accept what you're saying about the ones at Dunstan. So Ruth, I didn't know if you, at this point, whether you wanted to come in as to how, I mean, you helped formulate those recommendations, and I just wondered whether there was anything you wanted to add to the conversation.
Thank you. Well, just as another coincidence of timing, I had a note through this morning that said that the Department of Health and Social Care have opened a bid for defibrillators. So I'm sure we can, Elliot maybe could send the link around afterwards. I've put it in the chat for those that can access it. But the Department of Health and Social Care have opened a bid today to say that this is for community organisations to bid for funding for a defibrillator for their area. So this is exactly what we were hoping to see when I made the recommendation around Plymouth City Council promoting schemes to access funding. So we will obviously do our bit to get that out to as many places as we can, but I thought it was worth flagging now.
That's excellent. And obviously, Tony, there may well be agencies, etc., through you that would be very useful to tag into that, won't it? So I think if we make sure that we publicise that, whether that's on the council website or whatever way we have, Elliot, of doing that, and I think that would be very useful. David, do you want to come in there?
Just as a matter of sort of interest on the side, this month on my own ward, we've had one small company of butchers who's actually put one outside his shop, and a local residents association, etc., and they're really up for it. What they are concerned about is the actual usage of it, because a lot of people are a bit averse to whacking people with electricity. Your point, I think, is very well taken. I think that all councillors, if at all possible, should be part of their training ongoing to get CPR training, because in our own little areas we're sort of leaders in the community, and if we don't know, then how can we pass that on? Thanks, Chair. I
think that also comes back to making sure that those defibrillators are registered with the circuit, and I think I think we would like to get more information out of that to councillors about how that circuit works and what we should be doing, and about, you know, getting sort of socially responsible community people involved with this. And I think because it's first rate thing to do, and I think we need to think about who gives the courses and what sort of I was going to say availability there will be, because I think that is something that periodically we say let's try X, but we need to make sure the capacity is there within certain organisations. Jemima, do you want to come in?
Two things. On the recommendation where it says all defibrillator owners are encouraged to register their defibrillators, how are we going to do that? How are we encouraging people? And the second part is there any mechanism for people who might not have the funds to have a defibrillator to buy one, but are willing to offer their premises or the site to cite a defibrillator as their way of collating? Or again, if we're encouraging people to say, have you thought about having a defibrillator on the side of your shop or business or whatever?
And I think, Ruth, that's probably where we're saying about we need to have those discussions with the community at large, basically. And this is where Tony and Health Watch could help us. I mean, Gary, there must be sites that we know would be prudent to. And this, I think anybody that's sitting here around the table will have ideas, and I think it's a matter of let's work out how we collate that, Ruth. And when you look at the bid that's there, and I think we work out as a council how we can respond to that. I think we will know more over the next couple of weeks. I think really.
Um, So I think our role will be to promote this as widely as we can through community and voluntary sector, through yourselves, through anyone that can support us in doing that. In terms of the bid, it has to be done by the community rather than anything via us. So we're obviously happy to give any advice that we can. And the circuit is the way that these things will be registered, will be considered, will be looked at. We won't be trying to sort of duplicate a system around that. We just want everybody to be registering them on the circuit. And I'm sure anyone in the community voluntary sector, anyone out there in businesses, anyone that has got a defibrillator on or next to their premises will understand the importance of it, because that's where they've got one. And so I'm sure they'll see that by registering it onto the circuit, they make sure that the ambulance trust can make sure that it's utilised if it's required.
I think this way comms comes into the whole thing, doesn't it? And making sure that our website's clear as to how you do it, and going out to those community organisations. I mean, it may well be that POP can help as well in that advertising. So I think let's get thinking caps on over the next week to 10 days and look to having something out as soon as possible. Is there a cut-off date, Ruth, on the bids? Is that, if you can notice that, or if you could let Elliot know, and then we can make sure that that's in with any comms that we do. Jemima?
And I would add, I've in one of the occasions where I've waited a very long time for an ambulance, I was asked by the ambulance service if I knew where the nearest defibrillator was, and I didn't know about the circuit. So I think the sooner we can get that up to date with where all the defibrillators are located, because at the moment I think that is something that if you're waiting a long time for an ambulance, you will be asked by the ambulance service to come locate your nearest defibrillator in some cases.
Something that came out that was on my email system was about the ones at Plymouth stock, and in fact I think if we can publicise that link to where you can just go on your app and bring it up as to where it is, and whether it says whether it's 24-hour access, whether it's available now. So I think that's really was good that came out from that Plymouth stock bit, but you must be able to do that all over, and I'm sure let's get people to understand what the circuit is, how you access it, and how you make sure everything's registered. I think if we can get that information out now, that would be really, really useful. So I think we need to be getting hold of Richard Longford and the team to be helping us with that. David, do you want to add on?
Yeah, it's just also, of course, if we can get all that information as councillors, we can physically go around ourselves and say, oh, are you on or you're not on? Because I know where all mine are, and I don't know whether they're registered. So if I can find out which aren't registered, then I can obviously add them on. So each councillor, if that could be put out to each councillor, they can do their own wards.
Yep, a piece of work to do, and I'm sure we'll have willing volunteers to go around and check. I mean, I know Zoe was saying about this one down at Ernie Settle that had been put up, but nobody knew how to access it, etc. So I think it's a summer job to do while we're not getting wet trying to do it. So that sounds a very good idea. Okay, folks. So if you're all happy with that, we'll make sure that is a recommendation from this board, that we take on board what the health and adult health and social care wanted us to look at, and our recommendations are according. All right. So you're all happy with that. Great stuff. Right. Okay, now we'll go back to the minutes of the January meeting, which seems ages ago, I must admit, but are you all content that these minutes are as accurate as you could all remember that far back? Yep. No problems with that. So questions from the public. I understand there are no questions today that we need to bring to you, which brings us to item 7. Ruth and Debs, it says, but Debs isn't joining us, so
Oh,
it's a solo act
it's
there,
myself.
Ruth.
Thank you. So thank you very much. So you'll see in your pack that you have a report, which is for noting. It is a requirement that this report comes to the board, and you'll note a couple of things on it. The first thing you'll note is it's somewhat that the data that's reported in there is somewhat old data. So that is because we have to have the year has to end. The data then takes quite a long time to come to us in the format that it is here, and then the report has to be written. And then I believe there was a bit of a delay on us getting it onto the agenda. So first of all, I appreciate that the data that's reported in here is old, because this is reporting for the financial year 21-22. So it is here for your information and for your assurance. What I did want to just highlight really is that this report covers the health protection arena of work, and the way, and you'll appreciate, certainly pre-COVID anyway, our role around that is more around assurance than the doing of that work. But clearly there are some areas that overlap with the general work that we do, and we obviously work around those. And so this report really is to give you the assurance that there is a health protection system that sits, that considers communicable disease and environmental hazards, immunisation and screening, and healthcare associated infections. That is discharged through, there is a group that meets across Devon and Cornwall. We work together, and that's why you'll see that the report is actually under those group of local authorities rather than a specific Plymouth report. What I wanted to make you aware of is that should there be any issue around any of those elements of health protection, although we may not have the official data at that point, we will know that there is an issue that we want to be progressing. And so I would bring it to you if there was an emerging issue that was of concern that we needed to address more rapidly. So really, this report is more for completeness, to record a year that has been and gone, and to give you the assurances that the systems are in place and ongoing. So I think really that's there's a summary of the paper included in the notes, and the paper is for noting. I am happy to take questions. I am of course mindful that, as I say, the data is from a little while ago now.
Any questions, folks? Thanks, Ruth. You've stunned them into silence. No. I mean, we do need to commend, if we think about all the items that are raised in here, whether it's the vaccination programs and how they've continued during COVID, because that was part of this report. I think that the whole teams have done really well to keep up with this and to make sure that, whether it was children at risk, whether it's adults at risk and whatever. And I think we all congratulate the teams on the work that they put in for, it must have been sort of the COVID jabs that we were all having at the time. It would have been the second round, wouldn't it, Ruth, that we would have been having there. So, they all pulled together and worked really, really hard, and we're thankful that they were able to do that. But I understand that this is going to all of the health and wellbeing boards across the peninsula, really. So ours is, I think we might well be the last one to see it, but we will look forward to next year's, Ruth, which they must be pulling together now with all the data and all of that what they've had. So
Yeah.
we might see it sooner rather than later for that lot. So, but no questions, queries from anybody? No. Excellent. Okay then, folks. Ruth, thank you. And the board, I'm just asking you to note this report. All in agreement with that? Yep. All shaking, nodding heads rather, not shaking heads. Ruth, which brings us then to the 5-year integrated care strategy for NHS Devon. There's an update on that, please.
Thank you. And yes, again, this is somewhat of a procedural note here. So you'll all be aware that I think the last Health and Wellbeing Board, a draft of the ICS's 5-year board plan strategy came to the Health and Wellbeing Board, and subsequent to that, there was a workshop that many members attended to discuss the strategy in a bit more detail. Timings, of course, didn't allow the final draft to come to the actual board prior to it needing to be agreed by NHS Devon and go on to various to the various mechanisms that it needed to go to. And so there was a statement that was agreed by the chair of the Health and Wellbeing Board, Mary, but also went out to members in advance of you agreeing to sign it. And that statement is included within the papers. Clearly, the Health and Wellbeing Board were noting that they were engaged through the process of the development of the joint forward plan that were consulted and had the opportunity to raise questions and highlight potential omissions. The Health and Wellbeing Board endorsed the plan and was assured that it takes account of the current health and wellbeing strategies for Plymouth, and with that, of course, the needs assessment, etc. We also commented that the focus on inequalities in access and in outcomes is welcomed, and that we look forward to seeing the shift in resources required to deliver on this aim. So that statement, as I say, was agreed via email and from the chair of the Health and Wellbeing Board and went off. And there is a link now to the 5-year integrated care strategy on the One Devon website that is also included within the papers. Thank you.
Ruth, apparently that link doesn't work. Jemima's just tried going on it.
Right.
I'll circulate that one round. I've got a copy that works.
Thank you. It works in ModGov for me, so apologies. That must be some strange thing going on there. Sorry.
One of those things, the bits that I did make sure that we put in was that the focus on inequalities in access and outcomes was welcome, because we still need to keep poking about us getting that that fair share, or however we want to regard it as down in this end of Devon, etc. And it's something that we've we've pushed for a long time. I'm sure, and Chris is nodding here, and so is Gary. So I'm sure they're happy with that. Okay, so again, it's to note, and it's a sizable document, so I'm sure it will help you particularly if you're feeling insomnia hitting. But those of us that went to the workshop, I mean, there was a lot that we could input. It's a very comprehensive document, and we look forward to working with it to get it into a state of, I suppose, always changing it, really, isn't it? And working on what's important. Gary, did you want to come say something?
Thanks, Chair. I guess it was just a question of how we'll be updated on progress with that strategy, and when that is. I think that'll be quite interesting to hear at certain intervals, Ruth. And I don't know when or if that's planned or due to be planned in terms of updates.
There certainly are plans for the monitoring of the strategy, because I'm involved in a number of the work streams, so I'm aware of some of those. So in each of the different work streams, there's a range of indicators that have been put in place that will be measured. And I don't know the exact process and the exact timings, but certainly when that will go through to NHS Devon initially, and we can make sure that this board is cited on that.
Okay, folks. So I need to ask you officially to note it. All agreed? Yep. Thank you very much. Now,
Now, Chair, we're
Yes.
running slightly ahead of schedule. We've been quite efficient. So I'm going to request, unless there's any other business you wanted to bring up, just a 5-minute break so we can get the presenters in that need to present. Apologies, but we've been efficient.
Do you know about anybody else? But I was having fun and games trying to get my new phone working, so I've not had a drink at lunchtime, so I think I should be very pleased to do that. And if any of you others would like a drink or a hot drink, I'm sure we could find one if you wanted. All right, so let's be generous and say a 10-minute break, and we'll see you back here about 10 past then. All right, but if anybody wants a drink, follow me. Very slight delay on technical issues. So, would you two like to introduce yourselves then before we start?
Hello, I'm Sarah Gooding. I'm a Policy and Intelligence Officer in the Chief Executive's Office at Plymouth City Council.
And I'm Rob Nelder, Consultant in Public Health with Plymouth City Council. We're just waiting for Elliot. We're just waiting for the presentation, so no pressure, Elliot. Doing a sterling job.
Hello, so we've just got a few slides together here just to give you an overview of what's contained within the Plymouth report and some of the key messages that are contained within it. If you could just go down to the next slide, thank you. Next one. So the Plymouth report is essentially a needs assessment of the city. To understand the health of the city, it's essential to also understand the geography, its population and the environment within which its residents live. It's also important to understand the city's economic context. Plymouth's narrative JSNA is also contained within the Plymouth report. So the JSNA itself is a suite of documents, but the health chapter within the Plymouth report provides a narrative overview and contains all of the key messages. The Plymouth report includes a range of new data from the census 2021. Although the census was taken in 2021, some of the data has only just been released in the last few months. So this is really the first opportunity to analyse some of this data in a local context. And lastly, the Plymouth report provides a crucial part in the review cycle of the Plymouth Plan. The Plymouth Plan's on a 5-year review cycle, and the next review is due in 2024. So the Plymouth report will provide that evidence base to inform the review and help to guide some of the citywide discussions as to what changes are needed to address current challenges and future challenges within the city. If you could go on to the next one. The Plymouth report is divided into 6 sections, and the following slides will just give an overview of facts and figures from each section. I won't go through each infographic, but I'll just highlight a few from each slide. And just to let you know, all of these pages of infographics can be found in the report in the first page of each chapter, so they're always there for you to refer back to. Living. The living section introduces the city's geography and population and explores some key issues across the city, such as community cohesion, crime, deprivation and education. Plymouth's current population is 264,700. This is projected to increase to 273,300 by 2043. Particularly of note is the 31% increase in the over 65 population over the next 20 years, which amounts to circa 15,500 people. Plymouth's working age population is currently above average. However, this cohort is projected to decrease over the next 10 years, so there's going to be some significant changes to our population profile, and this will bring some challenges which Rob will outline later on. 77% of residents who responded to the city survey in 2022 think that Plymouth is a great place to live, while 65% agree they have pride in their local area. Just short of 9,900 children in the city are living in poverty, based on current poverty definitions.
Okay, so if you can toggle down to the healthy bit, fantastic. Yeah, I mean, one of the things I suppose that I wanted to say as well is the fact that please don't think this is just Sarah and I who've produced this. We've sort of coordinated its production, but it's been a real team effort by a number of individuals and teams across the council, which has resulted in this document, which I think is about just shy of 140 pages long. As you can see, you know, there are literally hundreds and hundreds of facts and figures in it. And already today, you know, your chair, Councillor Aspinall, has pointed out a little bit of clumsy wording that we've used in one of the bullets, which I'll tell you where the error is, okay, just in case, so to save you having to find it from within that. On page 7, the last paragraph in the healthy summary, there's just a little bit of clumsy wording which we've used there. The figures are correct, but if you were to read that, you could get the wrong impression. So, you know, with this, as you read it, if you find anything that aren't clear or need further clarification, or you think the wording needs to be improved a bit, then let us know and we will update it. Maybe I shouldn't have pointed you to the deliberate error, should I? I've done the wrong thing there. But anyway, so back to the bit that I'm supposed to be talking to you about. The healthy section of the report covers life expectancy, mortality, chronic disease, mental health, child health, lifestyle behaviours of vulnerable groups, and healthcare. Like with all of these sections in the Plymouth report, we could really write an entire report on those things themselves. And as Sarah's already said, what the report aims to do is to pick out just some of the key facts and figures about the issues that we as a city face. You know, the Plymouth report, again, as Sarah's alluded to, it doesn't contain everything about every topic, but it maybe points to issues, and I'll allude to some of those later on. So what is the healthy section? What are some of the headlines from the healthy section? Well, it shows that life expectancy in Plymouth has improved for both males and females in recent years. However, life expectancy in Plymouth remains below the national average. Then one of the issues it talks about as well is healthy life expectancy. So that's the average number of years a person can expect to live in good health. Healthy life expectancy is significantly lower than the England average for females in Plymouth. It's similar for males, but there's something going on with regards to female healthy life expectancy in Plymouth. And I think our Director of Public Health, Ruth, who's on the call, has made that point on a number of occasions. So that shouldn't be a surprise to you. We also highlight the fact that we've got approximately 30,500 people aged 18 to 16 in Plymouth, estimated to be suffering from common mental health problems, including depression, anxiety, and obsessive compulsive disorder, or OCD. Highlights the fact that alcohol and drug, both illegal and prescribed drug dependencies, are significant issues for Plymouth. And those, of course, link back to the previous information that I gave you around mental health problems, and also they, of course, link to homelessness, offending, and have negative impacts on families and children. It's not all bad news when it comes to health and well-being. As Sarah said, we've included census data, the most recent census data for 2021 in the report, and what that shows is that compared to the 2011 census, the 2021 census data on health shows an increase in the proportion of Plymouth residents reporting very good health and good health. So there is, some high level headline positive news on self-reported health and well-being in the figures as well. Moving on to the growing section. So the growing section covers employment and jobs, wages, productivity, innovation, labour demand, and skills and education. So another really sort of meaty, chunky section. What are some of the key headlines from that? Well, it shows that Plymouth has a marginally higher employment rate than nationally. It shows that the health and social work activity sectors remain the largest source of employment, but the manufacturing sector has seen year-on-year growth since 2018. Workforce wage data for Plymouth shows that wages increased faster than the national average over the 12 months to November 22, but we're still not comparable with the national average. We're only still at 92.3% of the national average. So we're moving in the right direction, but we're still not there, if you like. So we've still got a lower wage economy in Plymouth. The gender pay gap has been all but been eliminated, which is a positive finding in the report. Plymouth's got a lower proportion of the resident adult population that are economically active than the regional and national rates. As I've already alluded to with the manufacturing side of things, Plymouth's continuing to transform and rebalance its economy. The two industrial sectors that contribute most to the growth figures are manufacturing and the marine and defence sectors, which I think you'd probably expect. Something for Trivial Pursuit if you want it. Plymouth is in the top 4 fishing ports in England in terms of volume of catch landed. Then a bit specifically about the naval base. So as you're probably aware, Devonport Naval Base is the largest naval base in Western Europe, 650 acres, world-class infrastructure, highly skilled workforce, which accounts for 14.1% of the city's economic value and 10% of the city's total employment. And then just to finish on that section, in March 2021, it was announced that Plymouth would become one of 8 free ports, and that's expected to generate 3,500 high quality jobs in and around the city. So I think we're going to move on to the infrastructure section now, and I think Sarah's going to pick that one up.
Okay, so the infrastructure section covers housing demand and provision, local and strategic transport connectivity, digital connectivity, and climate change. Recent census data has shown us that just under a quarter of people in the city, adults in the city, are estimated to not have access to either a car or a van. Plymouth has slightly lower home ownership than seen nationally and higher private and social renting rates. Current average rental prices in the city are between £625 and just over £1,000, depending on the size of the property, while the average house price now is around 219,000. This is an increase of 41% since 2010. According to the most recent data, approximately 16,800 homes are currently in fuel poverty in the city. Moving on to the international section, this covers exports, culture and the visitor economy. The University of Plymouth is the 15th largest in the UK with over 18,500 students. Overall, just under 22,500 students study in Plymouth's 3 universities overall. Over 4 million people visited Plymouth in 2021, with visitor spend totalling 244 million. The visitor sector supports nearly 8,000 jobs in the city and accounts for 7% of Plymouth's total employment. Plymouth was the UK's first social enterprise city, and Plymouth has approximately 200 social enterprises employing over 9,000 people. Now I think it's over to Rob to discuss some of the challenges that have come out of the report.
Brilliant, thank you. Yeah, I mean, I suppose one of the things we wanted to do was as well as producing this massive report, which has got all of the facts and figures and interpretation in it, just to highlight for you and for the other people who will hopefully read the report what some of the big picture items are in terms of challenges and opportunities, because it's all very well putting a report like this together, but the question that's often asked is well, so what then? Am I supposed to go through 140 pages and try and work out what the big ticket items are? So to some extent, we tried to do that by putting the challenges and opportunities section in there. So what it does, as I've sort of said, it presents the main areas of concern that have emerged from those sections, and it aims to give policymakers such as yourselves with sort of a bit more food for thought. What it highlights is that Plymouth really faces similar challenges to many other UK cities, and will be impacted upon by significant change and turbulence in response to the events taking place both nationally and internationally. So Plymouth's pretty much the same from that perspective. But what we've got to do as a sort of health and wellbeing community and as partners across the city is address these challenges together to maximise the city's potential for growth and prosperity, and to take advantage of opportunities as they arise. And as I've already said, there are some key concerns raised within the report that warrant attention from city leaders such as yourselves to consider whether enough is being done to address these challenges, or maybe consider what more could possibly be done. So I'll just highlight a few of these things. Population change, that's one thing we've highlighted in the report. We've highlighted the increase in the 0 to 4 and the 65 plus populations, but a decrease in the working age population aged 15 to 64. A growing and changing population raises a number of challenges that we need to consider. There'll be impacts on future housing, education, employment, transport needs, and there'll be increased demands on provision of services related to health and to children and adult social care. So that's the first thing we've highlighted, the population change. Secondly, we've highlighted cost of living. That probably won't come as a surprise to you, and there's a lot of work going on already across Plymouth City Council related to cost of living that other colleagues in the room and on the call are experts in anyway, with some of the work that we're trying to do. But in terms of cost of living, what have we highlighted? Deprivation and poverty levels, which are already higher than the national average in some parts of the city, are likely to rise. Okay, so what we're going to see is a bad situation getting worse. That's what we've highlighted in the report. More people in food poverty and fuel poverty mean that health and living conditions are likely to deteriorate further for some of the city's residents. This negative impact on health and well-being could impact on life expectancy. We've already talked about healthy life expectancy, but the negative impact on health and well-being could impact on life expectancy as well as healthy life expectancy, and in terms of the latter one in particular, I've already alluded to the fact that that's an ongoing challenge for the city. So again, that might deepen the existing health inequalities that we're aware of. We highlight the climate emergency as well. There are extensive challenges on how Plymouth residents live and work are needed in order for us to achieve net zero by 2030. Journeys by cars, vans, heavy goods vehicles need to reduce by 25%. That's a massive challenge. Rethinking the journeys we take requires reliable and affordable public transport. Another massive challenge for us. To cut emissions from buildings, we need to improve our homes and make them more energy efficient. And as noted in section 5, there are over 5,000 private rented homes estimated to be part of a non-decent, or estimated to be of a non-decent standard. So there's a massive amount of work to be done around housing and buildings. In terms of unhealthy lives, we've already said that Plymouth has lower than average healthy life expectancy for women in particular, and lower than average life expectancy, although life expectancy is improving. We've all been through the pandemic together. What we found from that is that inequalities in health and wellbeing are likely to have been exacerbated, likely to have increased, and the entrenched mental health and other health inequalities that existed before the pandemic will have widened. We'll see an increase in over 65 population. That will place additional pressures on the already stretched health and social care services in the city. And again, as I've already alluded to, other challenges such as the increased cost of living are likely to impact upon health and wellbeing in the city. So those are really some of the big picture challenges that come out from the report. I think what you would expect to happen is that as people in different sectors read it, they'll become aware of specific challenges that we may not have picked up. So what we've tried to do is just really highlight some of the high level ones, but there are bound to be others in there that partners who read the report will pick out as well. So in terms of wider publication, I think Sarah's just going to finish off just talking about a little bit about that now.
So this is just a very draft timeline, but we just wanted to give you an idea of what we hope to do with the Plymouth Report next. It's now published online on the Council's webpage. We're hoping potentially to attend a Cabinet section in the next couple of months and to hold a set of internal management team meetings to really raise awareness of the Plymouth Report and outline some of the key messages and challenges that Rob's just highlighted. In September, October time, the report will be sent to all partnership chairs and key partners across the city with their invite to the Plymouth Plan Annual Convention. The Plymouth Plan Annual Convention will be held on the 16th of November, and that will launch the Plymouth Plan Review 2024, which I mentioned earlier, and start those citywide discussions on how the Plymouth Plan should be updated to reflect changes over the last few years and adequately address current and future challenges. This will be followed by a period of wider engagement in 2024 with partnership boards and across the city during the review process to have those sort of wider discussions. I think there's one more slide just to outline the recommendations that are in your papers. Number 1, the Health and Wellbeing Board formally adopts the Plymouth Report 2023, noting its contents and key messages. And number 2, members agree to promote the Plymouth Report 2023 within their own teams and organisations. Thank you.
Thank you, both of you. Wow, what are you going to say, folks, about this? I mean, it is it's a very detailed report, and I think certainly from my perspective, there's several things that it highlighted. I don't think, since obviously leaving midwifery many moons ago, I hadn't appreciated that the 0 to 4 cohort are now growing again. So I can see how that would be something that would be certainly thinking about school provision, etc., for the future. If the rest of it, if there's less in the other sort of 4 to 18-year-olds, then obviously you're going to end up with some of the academies maybe mothballing certain things. And how does that affect teacher training and all? There's a whole range of things, let alone what's happening with the health service. One of the tasks I've been giving is looking at ageing well or better ageing, whichever way around we want to put it. But there's a huge jump in that over 60s population, isn't there, Ruth, from what's being said there? So even more important that we think about that and sort of, I don't think any 60-year-old these days feels old. I think, everybody still wants to contribute and to be part of society. So I think it is, how do we manage that? So there's a whole lot of things in here to give us food for thought, before we launch into looking again at the Plymouth plan from next year, isn't it, really? So, your thoughts, team? Jemima?
I want to say thank you for this report. I think it's incredible. It's almost, don't really know where to start with the kind of really rich data and the facts, and I actually think it's required reading, never mind all the other people who are going to disseminate it to, for councillors, for members. There's like real interesting ward level data, and things that can provoke discussions and all kinds of things. As I say, I could ask about 10 million questions, but the two that really stand out for me are the data around young people's mental health and how we're going to tackle that burgeoning issue. It wasn't amazing before the pandemic, and I think even anecdotally I'm hearing how it's got much worse for a certain cohort of young people since the pandemic. And also, just back to housing, the Mental Health Foundation makes it very clear that one of the key factors in good mental health is having a secure, decent roof over your head, and the average rent part that you've highlighted, I think, is I want to mention it because I mentioned this in budget scrutiny, and I know this is health and wellbeing, but the local housing allowance is not keeping up with what the average rents are in Plymouth, and that is making it difficult to find for people to find good places to live, and that in turn is going to affect all parts of their life. But I'm especially worried about how it affects their mental health. So there isn't really a question in there. It's just those are the key things. And I suppose my question is, going right back to what I first said, is how this is going to be disseminated to members, to councillors in particular, whether you're planning on holding sessions around this that people can attend, or how that's going to work.
Ruth, I'll come back to you and Rob and that in a minute about how we disseminate it with particularly in-house. But I know David's got his hand up there. Did you want to come in there?
Yeah, thank you. Again, really interesting report. I mean, I suppose without picking out any specific areas, I guess my question, and I guess it's the first health and wellbeing board I've been to, but it is very much around the practical application of some of the issues. So there's scoping the current position. I think there's also something, of course, we always focus on those areas where we're different, perhaps, or at variance with our national counterparts. But there were some, in terms of, is there any learning in terms of improvement? It was commented regarding the improvement in life expectancy, some of the reported improvement in wellbeing metrics, which are all successes, potential successes. And what's the understanding and the intelligence that underpins driving some of those improvements, and how do we ensure that we capture those and ensure that we maintain those principles in the services that we commission across local authority, health service, and broader, really. So I suppose my question is, with all of this information, how do we use that in a way to lobby for funding? How do we use that in a way in terms of the services we are looking to commission? How do we capture and evaluate where we have done we do have our successes to ensure we don't lose some of those successes, as well as identifying perhaps some areas where we perhaps need to look at a different approach or what have you. So lots of questions in there, Ruth and team, and apologies for that, but that's where I find myself curious regarding.
Sarah and Rob, do you want to take what basically now happens with this, and how do we? I mean, I think Jemima is right. We need to be making sure all councillors have a copy of it. Now, whether they will read it online or whether they need a physical copy, I think that's something that each councillor needs to decide which they want, so that it's going to be useful. But I think really, again, what David was saying, how do we use this information? It can't just sit there. And Jemima's right. I mean, the bit that I was a little bit concerned about was that there's a huge number not living in decent homes, and if we're trying to progress to the next stage with the thinking about carbon reduction, if the homes aren't sufficient now, how's that going to? There's so many nuances and facts in here that it's going to be difficult to unravel it. So I think if you can get that idea, then I think probably then from a CMT point of view is how is the CMT going to use this to look to how they progress their departments for the future as well, isn't it? So I'll start with you two if you don't mind.
Yeah, that's fine. I mean, I think what's really interesting to me is the conversation that you've just had now is a sort of exactly what we wanted to happen with it. In other words, it doesn't contain all the answers because it never could. What it's doing is giving you, and I'm sure people have only just had a chance to glance through it, not read it word for word, but it's already giving you areas where you want to do more of a deep dive to be done. Just the two that Councillor Lang mentioned about young people's mental health and housing. You know, you could write a book on those things alone, but the fact that you've picked those out, it's likely that further work needs to be done. So that's the very point of this document, is to give the headlines, if you like, that further deep dive pieces of work need to be done to understand what those issues are. And again, picking up on David's point online there, you know, it's not just where some of the issues from a negative perspective are, but we need to learn where some of the issues are from a positive perspective as well. Because if things have changed, we need to know why those things have changed for the positive as well. So I completely agree that I think Ruth will probably say this in a minute, so I'll say it first and then Ruth can say it. I think this is Ruth will always says this is one of the few documents, the Plymouth Report, that she has, you know, a hard copy of and carries around with her because there's so much stuff in it. And I think that's almost like our ambition, I suppose, for councillors and others on this board and all partners across the city, that it is something that people have that they can refer to and dip in and out of, and it provides pointers for where further work needs to be done. I think one of the slides that Sarah presented was the dissemination plan, and as Sarah said, that's just a draft at this point, and what we've got to do is go back and do further work about how we disseminate the report and the findings of the report, because I think it's a resource. I mean, that's why we've produced it. It's a resource that we want to get out there as widely as possible for people to read and for people to then look and do deep dives into further into the topics within it. And we've just picked out some of the headlines in the challenges and opportunities section, but they're not the only ones. They're just the ones that jumped out at us. But again, you know, Councillor Lang, just having given it a bit of thought, has picked out two other challenges from it, and I'm sure everyone on that side of the table could pick out at least a dozen in about 5 minutes. So that the next step for us is really to think about dissemination, to get it out there as far and wide as possible.
Thank you, David.
Can I just say, by the chair, it's one of the most comprehensive and best reports I've certainly read in the last 2 or 3 years, so thank you very much for that. On my side, I was looking at life expectancy for the more senior people as time progresses and so on. I mean, I'm getting there myself, but yeah, it's so much in it. Every councillor, please, Chair, must have a copy of this. It's going to take a month of Sundays to read through it, but there's so much in it. And just thank you very much. Thank you, Chair.
Certainly, I've got 2 recommendations anyway for today, but I've added now a third, is to recommend that all councillors receive a copy in the way that they would choose, whether it's a paper copy or whether it's online, because certainly some people do better online than whatever. So I think that's certainly a third thing I'm putting on here. Gary, did you want to come?
Yeah, just briefly, one with a comment and then a question, but I think you can only echo and agree with the comments about the richness of the document, and thanks to Rob, Sarah and everyone else who's involved in producing it. I think there's just so much information in there. There's something literally for everyone, I think. I think the thing I heard most that's really important is the process that happens now with the document in terms of getting it out there so that everyone can look and talk about the things they pick out and that they're going to do differently. And in a way, you shouldn't assume, but it almost feels like the good progress that's noted in the report as well will be a result of some of that process through previous years. I think my question, and I think David alluded a little bit to it. So, and I'll use an example. So, for example, the population breakdowns that you've done in terms of looking forward. Do we compare, and how does that compare in terms of national predictions, and how is that used? And I think that you mentioned it as well in terms of things like funding formulas and all of those other things coming down the tracks. I don't know if you have got the answer to that, but I'd be kind of interested in that, how we compare our Plymouth report to some of the national indicators which drive some of those formulas and things for us in the future.
Yeah, I mean, if I deal with the second bit first, the sort of how used, then, you know, if we know that the population is going to change, I think as Councillor Aspin, as Chair, has said, what we highlight in here are the implications of that changing population. So I suppose what we're saying is things shouldn't come as a surprise to us in years to come, because we're highlighting it now. So we have to put the services, enable services to evolve on the basis of that population change. We probably all saw the horror story on the news maybe a week or so ago about school provision somewhere else in the country, where they hadn't, you know, there was a new housing estate built and they hadn't built the right amount of early years places, I think, and we don't want to ever be in that situation. So, you know, we've highlighted in here how things are going to change, and, you know, as partners in the city, we need to make sure that services evolve on the basis of that change that we've highlighted. In terms of how we compare with other areas, that, you know, that is highlighted in the report. You know, Plymouth as a city isn't massively different from other cities up and down, other, you know, deprived cities up and down the country, and that's led me on to something else which I wanted to say as well, is that bear in mind that the Plymouth report, although it's got hundreds and hundreds of facts and figures in it, those facts and figures can all be further broken down as well. So, you know, we've only highlighted some of the population stuff in here. Again, you could write a book on population change in the city, and it might be necessary for us to do that at some point. The census data has just come out. This just contains some of the census data, not all of it. So I suppose what, again, I want to highlight is that if there are issues in here that start to jump out, like population change as another one, then further work could be done on that in terms of a deep dive to see what the real implications are going to be over the coming few years.
Laura.
Thank you. So I've got some points, I think. I don't think they're questions. But my first one is, and it's about a bee in the bonnet that I have, and a real interest in, and that's healthy and unhealthy high streets, and the fact that we know that we've got certain members of the population who are in poverty, and they're in food poverty, but it's their access to healthy food as well, and the fact that they don't live near shops where they can get healthy food. So I think that would be something that perhaps could be brought into the report, because I didn't see it, and it could have just been that I wasn't looking at it closely enough. But it's something that's really important, because it's about underpinning those decisions that are made when it comes to planning. And the second one is, when it comes to this report, it's really the dissemination of it. I love the fact that you're saying it's got to go to all councillors, and I think that's really important. But I also think it should be way much more wide than that. I think it should go to every single GP practice. I think it should be distributed amongst universities that call themselves civic institutions. If we're civic, then this tells us in roadmaps where we should be doing work to try and improve some of these statistics that need looked at, and that we know now where we could make a difference. And then my third thing is that, and this is again with an outside hat on, so excuse me if I'm talking out of turn here, but I was looking at this report and I was thinking about some of the recent decisions that have been made by the council and future decisions as well. And it's just thinking about, how do they align? So how can you show that recent decisions are making sense in light of this current report or not. So it's doing that bit of scrutiny, and if they do align, then I think that's a really positive story to be getting out into the wider population. And if they don't, then it's time that we can go back and start looking at those decisions again with fresh eyes, which is what you have newly in the council, which is the last thing that I think that I wanted to say, really. And also to look at the opportunities as well. So with the fact that we've got this growing population of 65 plus, that could, you know, there are problems with that. There will be, especially when we see the life expectancy, the healthy life expectancy of about 64. But then I'm thinking there's this incredible potential work volunteering force out there. And if we can just think, how can we harness that? Because by doing that as well, you're going to be improving the health of that particular community as well. Because all the research shows that the more actively involved they are in community projects, that they feel valued, that they have value to society. And if we've got that that's growing, then actually what we should be trying to plan ahead is how do we get them actively involved, because they're the ones with space and time. Anyway, those are just my thoughts.
No, thank you. That's very useful, and I think we would probably want to pick your brain as to who at the uni in particular that we could aim this report as, because if you send it an email and what they do, whatever. But I think that would be really useful, and that's the whole idea of this board is looking. I've got Ruth wants to come in, and then Chris.
Thank you. I just wanted to go just up a level again and just make sure that we're all understanding and all clear on the context. So if you remember back to 2014 when the Plymouth plan was set in place, 20-year plan that made it very clear what we needed to do across the city. It made it clear our ambition to tackle health inequalities as one of quite a few other issues, but it was very clear that that was one of our really clear drivers in what we do. And many of the topics that are contained within that Plymouth report are, of course, the wider determinants of health, the impact on health and impact on health inequalities. Underneath the Plymouth plan, and of course within that, there were a number of planning policies which actually do cover things like fast food takeaways and things like that. Underneath it, we had the plans for, if you remember, so plan for sport, plan for housing, etc., etc. So those plans are so what are we going to try and do about it, and what are the outputs? So we're measuring those in outputs. Then you've got external context, and clearly over the last 10 years or so, we've had quite a lot of external context that we maybe need to take into account, which means that the route to us delivering our plans for are not perhaps as straightforward as they might have once been. So, for example, global pandemic, very clear example of where the context that happening has changed the context of much of what we're doing. And so the trajectories that we thought we were on and the way in which we thought we were developing have taken a bit of a turn for the worse. So there are others, of course, cost of living, economic downturn, impact of austerity, all sorts of things that the external context that shape what we do. Clearly, it's very easy to have a plan for something, but if you don't have the money, if you don't have the infrastructure to change the way you operate across the city, then those things can slow down what progress you make. And then there's so then of course there's what is the outcome that we measure, and a lot of what's in the report is around those outcomes, some of which are showing some positive elements, some of which are really not. And as I say, you have to take into account not just what we've done, but also those external contexts and how those have shaped what we've tried to achieve and how they've impacted on the population as well. So that question about what do we think's made the difference, we have actually had some funding to set up a research what's the right phrase, collaboration, within Plymouth City Council, working with the university to try to answer some of those questions on what does make the difference in those really quite complex issues, because it isn't straightforward. But I would certainly say that having clear aims and really working together across the city, we have all come together across the city, and I absolutely include community and voluntary sector as a part of that. As anyone who knows me knows that they're really central to so much of the work that we do. And we've tried to do what we can for people and with people. So by understanding the issues, the complexities that are facing people. And so that just to set that sort of context around things. I do think that I see the document is a little bit of a reference to me. It's a reference book as opposed to a narrative book. So I dip in and out of it. It'll be the place that you go to when you suddenly think, oh, I wonder what the situation is around that. If you were developing a particular area of work, you might look in there to start the conversation about what are we seeing across Plymouth. But it has to be read in the context with our Plymouth plan and then our plans for to see how that all fits together, how that story all fits together. Thank you.
Thank you, Ruth. I've got John, then Chris.
Thank you, Chair. Rob, I wonder whether you could elaborate a bit on healthy life expectancy, which has always perplexed me a bit, and it's been raised earlier. How is this assessed? And it's quite frightening that, you know, some of us here should be not in healthy life areas at the moment. Obviously, it's an average, and some people might not think or might not be healthy at 45 and others are still healthy at 85, but the figures are quite frightening, and they're better for men than women, although actually women don't die any earlier in our area to our comparator areas, even if they think they're less healthy. Is it self-assessment? Is it based on data, illness and whatever? I'm just a bit perplexed, and you know, it's slightly complex, I have a feeling.
Yeah, I mean, the thing is, I don't know if Ruth wants to come in on this, only because of the fact I'm aware that Ruth's done a report on life expectancy for this board previously, but it's yeah, I mean, you are absolutely right. I mean, life expectancy itself, life expectancy per se is quite a complicated calculation based on birth rates, death rates, etc., etc. Healthy life expectancy, you know, as I don't want to sound rude, but the clue is almost in the title in terms of it being the, you know, the average number of years that a person can be expected to live before they suffer the effects of ill health. Off the top of my head, I can't remember the definition. I don't believe it's self-reported necessarily. I don't know whether Ruth can probably correct me on that.
Yes. So as you say, it is quite complicated. Obviously, life expectancy is a more straightforward measure for a good reason, that the point at which you die is very well recorded and clearly fairly absolute. For healthy life expectancy, it does use a measure of self-assessment. So there is a self-assessment of when people are unhealthy, or that their health is significantly impacting their life. And so, yes, there is an element of that. It is a bit of a puzzle to me, anyway, at the moment, as to why we're doing so well with male healthy life expectancy, where we're very, very similar to the England average. We're still slightly below, but we are very similar, compared to the female healthy life expectancy, where we are significantly lower than England, but we're also lower than most of our comparators, our statistical comparators. And I agree that is a little bit of a mystery. We are doing a lot of work to try to understand whether there is a specific reason behind that. And you won't be surprised to find me say that there is no simple, straightforward example. So I can't say, you know, it's because the treatment for Y isn't happening, or more people are dying from, are becoming ill from a particular disease. It really is not that straightforward and simple. Those trends are not very easy to find. So we are doing some work regionally. There was recently a women's health strategy that came out. So we're doing some work regionally to try to use Plymouth as a bit of a test case to try to see what the collective forces of local authority, UK HSA, the Health Security Agency, and the Office for Health and disparities can understand, to see if we can shed some light on it together. So there's a piece of work going on about that now. But yes, it is complicated. The other thing is that it mirrors the disability life expectancy as well. So the point at which you become disabled. So again, it doesn't look as if it's out of kilter with what other data is telling us, but it is quite a worrying statistic.
Thank you, Ruth and Rob.
Chris.
Thank you, Chair. So it's just a comment, really. As has already been described, the richness of the data in there and the opportunity around connectivity across the different measures. Appreciate, as Ruth says, it's a reference point amongst other things, including centrally the Plymouth Plan, and just really the observation around how that feeds back into our local care partnership arrangements and that are underpinned by all of that in terms of the approach that we take. And I suppose it just a point in terms of the distribution in your approach, linking that in through the local care partnership across all members, that will be really helpful. We have started to make that connectivity back in terms of refreshing on and checking back against the priorities that we've got set within the LCP, which obviously this is an important part of, but I think for all partners to see that and see that connectivity too would be really helpful.
Tony, did you want to come in on this?
Apart from saying a big thanks to the team for a very, very comprehensive report, I think I know it's on my pad to Chris actually about the LCP, and I think that is a very useful place for this document to come to, because there's so much work going on around health, social care and other stuff that it needs to be coordinated, and if you've got this reference document, then that will help.
Thank you. Sarah, can you just remind us then what the next process from this is? You were saying about, I've got 16th of November here, and sort of this is when we then start looking at the Plymouth Plan refresh.
Yes, so we've got the second Plymouth Plan annual conference on the 16th of November, which so in the run up to that we'll be sending out invites to every chair and vice chair of every partnership board and to other key partners, and we'll send a copy of the Plymouth report as that evidence base, and that the discussions will happen there in the annual conference in November, and then that will lead into the Plymouth Plan review, which is taking place next year.
So just a little bit of work then, just to keep you occupied, shout out mischief. I think, yeah, we've, as you say, we've a big thank you to Ruth, to you, the team, Sarah and the team that you work with, and Rob, for all the work that you've put into this. I've got some recommendations here that I would like you to take on board. The board formally adopts the Plymouth Report 2023, noting its content and key messages. Secondly, that the Health and Wellbeing Board members agree to promote the Plymouth Report 2023 within their own teams and organisations. And then thirdly, I've put in here, recommend all councillors to receive a report. I don't think it's quite needed to put in whatever form they want to, but I think we basically make sure it's there. Anybody else want to add anything else in from that?
Just through discussions earlier, Chair, did you want to add in the university and wider groups as was suggested, or should we keep it to councils?
No, I think that comes within promoting the Plymouth Report 2023 within their own teams and organisations. And I think, Laura, we need to find out where you think it ought to be aimed at, and whatever. So is that reasonable? You're happy that that encompasses that? Yep. Okay, right. Thank you. Can I have a vote on that, please? All agreed? Yep. Lovely. Thanks very much indeed. Sarah, Rob, thank you very much. And Ruth, thank you for your input there as well. You know, a brilliant piece of work, and it'll be interesting to see how many of our colleagues read it, Jemima, and how many suddenly think, good gracious, I didn't realise that about my ward and whatever. So I think that's another, as you say, another tool for the toolbox. So thank you. Now John's here, I'm just going to go back an item, or a few items, and say, can I all have your agreement that we appoint John Mahoney Vice Chair of this board for the coming year? All agreed? Thank you. Thank you. Right.
Thank you very much. Shall I stay here today? Or do
Oh, yes. Yeah. No problem. We won't expect you to move chairs now. Rachel, I'm sorry we were so far ahead of ourselves. It was unbelievable, which is unusual. You know that. So welcome. And and you're going to be discussing with us the Community Empowerment Update, which is pages 57 to 90 in our agenda packs. The floor is yours, Rachel.
Other button. Okay, thank you, Chair. So yes, we've got some slides that we'll talk through about the Community Empowerment Programme. I gather, hopefully you've got them. Oh, I've got to share them. Okay, fine. Oh, thanks, Elliot. I can share them if you need me to. Oh, thank you. Lovely. Okay, so if you move on to the next slide, thank you. So my role is community. I'll just mute myself. Oh, you've joined, Elliot, so is that why? Yeah. So my role is Community Empowerment Operational Lead for Plymouth City Council. I'm based in public health, but obviously Community Empowerment is a programme that cuts across the whole of the local authority. And as the definition for community empowerment then is, we've defined it as the process of enabling communities to increase control over their lives and to make their voices heard in shaping the services they use and the places they live. So I think it's really important there that we've got kind of two kind of angles to this. One is about enabling communities to increase control over their lives, but it's also about us listening to communities in terms of shaping services that they use. So those are two very important aspects. And so as a council, we're committed to working together for a fairer, greener and healthier city, and that has been reinforced in the new corporate plan that's coming out from the new administration, very much about fairer, greener and healthier city. But it does build very much on the Plymouth Plan. So as you've just been through the Plymouth Plan, it builds very much on the Plymouth Plan principles about, promoting sharing and devolving of power, and making sure that communities are able to influence decisions and that we make decisions in a very transparent way. It's also really important, community empowerment, in terms of reducing inequality. This is all part of us listening to communities and helping to support communities to tackle those things which are creating inequalities within our community. But on a positive note, COVID-19 proved one of the things that did come out of the pandemic was that when we work together, we can transform our city. And there were within, we had our Good Neighbours scheme. We had admittedly people who were furloughed, but we had 800 volunteers. We had 70 plus neighbourhood groups, and we did lots of really good things. The council helped coordinate the Christmas meal in a box. The box itself, our cultural centre, helped to coordinate that. We had Caring for Plymouth, which was the plan around how we cared for people who are shielding or not able to go out, who are vulnerable to COVID, and obviously the Good Neighbours scheme, and then Resurgam, which was all about how we rebuild the economy following COVID. So that's all that's really fed into the whole plan around community empowerment. That's where it all sort of came from, or got turbocharged really during COVID. Next slide, please. Elliot, thank you. So the Community Empowerment Programme has got five themes, and those are, so looking on the left, you have engagement. So this is about how does the local authority engage with the community and listen to communities. And we're building very much on good practice. There's lots of really good practice around. A lot of you will have heard about the phrase appreciative inquiry. We've done a lot of work around how we listen to communities and developing our skills as a council in terms. So appreciative inquiry is basically about listening and having good conversations with people. We're going to do a lot of around events in the city and engaging residents through events, and we'll have an annual plan on that. Leadership and cultural change. This is very much about how we develop again our leadership as a local authority, and it's about sharing good practice, about using appreciative inquiry, And also we're developing our approach around asset-based community development, and I will talk in the slides later on a lot more about this and about the Community Builders programme. But it's really about, rather than thinking about, although we do have to identify areas of need, and we do obviously look at all the data around need, and that's a lot of that is in the Plymouth plan. It's also looking at the assets and what are the really positive things in the community, not just physical assets, but also the skills, the enthusiasm, the knowledge of local people that can contribute towards making Plymouth a fairer and better place to live. So it's a really almost like turning things on their head and looking at the assets in the community and working to develop those. And I'll talk a bit more about that in the slides as they come up. Embedding equalities is really important. Equalities, as I said, central to community empowerment. Third one, creating the conditions to empower people. So this is about building on all the good work in the voluntary community social enterprise sectors, making sure that we create the conditions for that sector to flourish, and that we make sure that people are able to get involved in co-designing services. That's again about listening to people, developing new wellbeing hubs across the city. We have 6 active hubs at the moment, but we're moving quite quickly towards having 3 more in the next couple of years. And again, asset-based community development. And then volunteering. Volunteering is really important. Again, this is, as I said just now, that something that grew very quickly during COVID. We want very much to build on that. So it's about informal mutual aid groups, people supporting each other, neighbours supporting neighbours, but it's also about being really good about formal volunteering and having consistency in recruitment and support for formal volunteers, and making that a really good high quality experience for people, and increasing also the diversity of volunteers, the number of volunteers. And then finally, enabling community resilience. That's so we can't really expect to empower communities unless we're supporting people in terms of those things that are that are create difficulties. So we've got making sure that people are digitally included, making sure we're tackling the climate emergency, and then all those issues around financial poverty, food and energy and security. One of the things I should probably say at this point is that I'm not suggesting that the public health team or my team are doing all of this work. This is something that, as I said, is a cross-cutting council programme, and there are teams across the council who are working on all of these areas. But we obviously see it as part of the umbrella of the Community Empowerment Programme. Thanks. Next slide. Thanks. So we're going to move now into talking in more depth about the Community Builders programme. This is a set of slides that we developed after the first 3 months of data. The Community Builders were recruited last November. They didn't really get up and running until, I suppose, January in effect. So, but we are very sort of close to having the 6 months data. So we will obviously want to share the 6 months data with you. But this is, as I say, the first 3 months reflection. I'm just going to very briefly talk about the background and scope, how it links to the resilience programme, who the community builders are, and also some on the slides you'll see links to some resources about community empowerment and community building, and we're very much encouraging people to hang out with the team. So really want you to, if you get the opportunity, and the photograph on that slide is of Tracy Lee, our chief executive, who went and hung out with the community builders for a couple of hours, and it's just really encourage anyone to come and meet the community builders team. Next slide. So the background is that this is, I don't know, sorry, it says draft in water. I don't know what it says out there. So this investment is funding from the NHS. It's what we have known in Plymouth as the Fair Shares programme. It's a programme of investment into Plymouth as a way of getting money from other parts of Devon into Plymouth because of the underinvestment that we've had in the city over the years. And really pleased to say that we managed to put together a bid for £800,000, and we got the investment into these are the areas of work. So into increased number of wellbeing hubs, into increased social prescribing in wellbeing hubs, and the community builders. And then a whole lot of work around wellbeing that the community builders can refer people into. It does support the implementation of the community mental health framework, because we're very much using this funding to increase people's well-being. But it's about population level, prevention and improving people's well-being, as opposed to actually providing services. So it's very much about. So those are the three areas we're focusing on. So it's connecting citizens and community building, developing more voluntary sector well-being and support, and individual resilience. Those are the three areas. I note that Elliot's now got up, so I don't know if you can. Sorry. Move on to the next slide while you're. Thank you. So just to quickly explain the structure there, we've got the three areas on the left that I've just told you about. And what that leads into then is these are the things that we're actually spending the money on. So as I say, with Citizen Connection, it's wellbeing hubs and community builders. We're going to talk more about community builders in a minute. So in terms of the wellbeing and support, it's supporting the Belong in Plymouth programme, which is a programme to tackle loneliness and social isolation. It's about having sharing good practice through communities of practice. It's through and supporting neighbourhoods and networks. So it's all about kind of developing capacity in communities, basically. And there is a pot of funding, which we call Sparks funding, which is around individuals and communities being able to develop their own wellbeing initiatives. And then the third strand, individual resilience, we've got we're working with those organisations, Food Plymouth, Citizens Advice and the community builders, to do work around developing alternatives really to, we're trying to move away from the traditional food aid and food banks towards much more longer term sustainable models where people are actually part of the solution. So there's people joining food co-ops, and also doing Food is Fun is all about cooking skills and shopping skills. But I'll talk a bit more about these things in a minute. Next slide, please. Thank you. So just to talk a bit more about the resilience programme then. This is a programme of support for individuals to tackle financial insecurity. So Citizens Advice are being funded to do income maximisation work, and they're basing themselves in community venues, children's centres and wellbeing hubs. And they're actually training a whole load of volunteers. So where this is actually a new approach is that they're training volunteers to do the advice, and we're hoping that will then create a much more sustainable system with much more knowledge across the city about how to increase people's incomes and benefit advice. We've got food growing on a budget sessions. We've got shopping and cooking on a budget. All of those sessions are happening. And then, as I say, we've got a worker, Kelly, who's developing food co-ops, small scale co-ops with residents buying food together, food clubs and larger social supermarkets. And the whole idea of that, as I say, is to move away from the food bank approach, because that is very much, it doesn't really give people control over their own lives if they're having to go and get food parcels. And then working with Plymouth Energy Community on energy champions and increasing people's knowledge of how to save energy. Next slide, thanks, Elliot. So the Community Builders team, we have 13 members of the team working with 15 communities, and I'm going to talk a bit in a minute about why we chosen those communities. But there are those communities of geography, which I will talk about in a minute as to why we chose those, and then there are communities of identity as well. And this was based not only on indices of deprivation, but it was also based on a whole load of data about those groups and communities that don't feel that they really belong in their community, that don't feel they've got any influence, that don't feel necessarily that they've got pride in their community. So that is how we selected those community groups, and there's a photograph there of some of the community builders. Thanks, Elliot. So the next what's happened there? That's a bit weird. Oh no, going backwards. If you go back a bit, there's. I wonder if that's to do with the way it's set up. Yeah, there's a whole series of slides just after. Yeah, that one, next one. Yeah. So this, the way this is set up, you can click, but you should be able to click through the slides. You can click on there as well. So it just demonstrates. It has some maps. So what it is it explains why we chose those communities based on so the index of multiple deprivation, but also city survey data. I say about where people feel in Plymouth that they don't feel that they belong, they don't feel they can influence decisions, or feel that they put pride in their community. and those are some of the areas which don't perform very well in that data. So we combined all those factors, and also we looked at where there were already community builders in place, because we know that there are community development workers in the city already that exist, and we didn't want to duplicate that, so we that's how we selected the community builders, the geographical and communities of identity. And then the next few slides, just click through. You can just click. I think, yeah. This you just see that yeah, there's probably it demonstrates that they're geographically located in the areas of multiple deprivation and also those city survey data, but they're also it goes through the city survey basically and shows you how they that data links as well. So we can send the slides out and you can see how that works. So anyway, yeah, for the first 3 months, what they've been doing is getting to know their local communities, making relationships with what we're calling community connectors. Community connectors are all kinds of people, volunteers, who know all about their community, who are active in their community, and who do things for their neighbours and so on. So it's about building relationships with those people. They've been attending events. They've been doing lots of appreciative inquiry conversations and collecting stories. And also, of course, because they're new, they've been doing lots of training around things like dementia awareness and all the things that we'd want them to be trained in as well. Next slide, please. So in terms of data monitoring, we have a logic model, which is I'm not necessarily going to talk through that now, but it's in the appendices to the slides. So the Plymouth University helped us to develop that, and we held a workshop. We actually had 3 workshops with the voluntary and community sector, where we looked at what are the things that we're trying to influence, obviously health inequalities and promoting mental health, and how would we achieve that. And we developed our logic model along those lines, which basically tells us kind of what the outcomes are we're trying to achieve and how we're going to achieve them and how we're going to measure that. So that's at the end of the slide. You can look at that. And we have obviously been collecting quantitative data, which I'll talk through in a minute. We're now working very much with the University of Plymouth on the qualitative evaluation. So we have support from Richard Bing's team, actually, in University of Plymouth, who are going to be developing a really much more in-depth qualitative evaluation, which we'll be able to bring back to the board and to the LCP. And there'll be an interim report in November, in the autumn, and there'll be a final report sort of next spring, summer, which we'll then be able to kind of demonstrate, hopefully, the impact of the programme. Thanks. So just briefly, the data has been, obviously I'd say this was only the first 3 months, and then I'd say they weren't even really active in the first couple of months, so we'll see some more data coming out at the end of June. But lots of people involved in developing new community activity, lots of community connectors engaged with, lots of community-led activity, community events, and more volunteers basically getting involved, and conversations being had. So that's the kind of data that we're starting to collect. And again, these are from the community builders that work cross-cutting with the communities of identity. Again, similar sort of data that we're collecting from those community builders as well. Just some really nice examples of things that they're doing. So I think I'm just trying to pick out, things like so one about supporting people from the LGBTQA plus community to set up a Pride pop-up group in Southway. So, actually talking to local people, finding people who need, who want to be involved and connecting them with other people and getting groups up and running. The Mental Health Alliance Listening Project, they're relaunching the Mental Health Network as well, which is going to be really useful, because that was a really active network before COVID, and it stopped happening in COVID, but we're going to get that up and running again. And then the next slide is examples of cross-cutting work with agencies and partnerships. And again, things like NHS initiatives, where the NHS, where we've got things like suicide prevention, lung cancer screening, all kinds of things. In fact, there's a lot happened in the last 3 months, actually, which would be interesting to see, where the community builders are really linking people into other initiatives around health and getting people who need, or that we want to hear from, and also that we want to link into health support. But they've done loads of work with lots of organisations across the city and really linking people together. so appreciative inquiry really important. This is just really about listening to people and making sure that we're gathering information. And one of the things that will be really useful for us will be how do we gather all this information and feed it back, have a kind of feedback loop into the council, into the LCP about what we're hearing from communities, and then that will lead to hopefully service improvement as well. That's the whole idea, is having a kind of feedback loop. Yeah, just so that you know that these exist. Community builders have been doing asset mapping over their communities, and these are on our Plymouth City Council website, so you might find that useful. That they're going to also be updated regularly. So this is about where all the assets are in each community, and right down to community groups, not just buildings, but where there's community activity. So we're hoping this will be really useful for people like social services, social workers, health workers, etc. So we're going to be promoting these much more. And this just really is the final slide, is just about where all the resources there. So we've got the asset maps, we've got the community empowerment webpage where lots of this is in. You can look at a lot of this information. And also the community builders, they're actually employed by Four Greens Community Trust, and so there's lots of information there as well. Please email us if you want to know any more, but also, as I say, really would be very welcome to come and meet the team at any time. Please feel free to get in touch. And I think that's it, apart from there's a couple of, appendices slides which you can look at. I won't talk through those in detail. Thanks. Thank you.
Rachel, thank you very much indeed. And certainly it's been interesting meeting, from the councillor's point of view, meeting those community builders that are working within our own areas, and I certainly know they've been busy. So, yeah. Any questions, any queries? Joanna?
Yeah, I think it's really interesting project, and obviously I'm going to be interested to see the data of when it becomes more meaningful and more available. Can you encapsulate what you want it to achieve, what your hope is and your aspiration for the project?
Yeah, so I think the whole theory behind asset-based community development, as I said, is the idea is that within each community there are people and assets, people who have skills, who have enthusiasm, energy to do things, and really what they need is a bit of support and a bit of direction, and sometimes maybe a little bit of funding, but mostly it isn't about money. It's about bringing people who have similar goals together, similar sort of visions together in communities to get and help them, to support them to do things. And it's really it's a really powerful thing that I think, as I say, I think we tend to see often. I mean, talking personally, I've in the past often seen things in very much a deficit way of where are the problems, what are the issues, how we're going to solve problems for people, and trying to do things for people. And it's changing that around and saying actually people can do things for themselves, and we don't need to be as a council doing things for people where they can do things for themselves. Clearly not everybody, we do need to provide services for people who need them, but it's actually about galvanizing those communities and really trying to create strong, resilient communities. And there are so many examples across the world, and we've got Cormac Russell coming, actually, who's the kind of international guru of ABCD, coming to speak to our senior management, but also to councillors in September. And there are so many fantastic examples around the world of where this work has happened and the difference it's made, and it's really inspiring. And I just think that if we can make this work in Plymouth, then we will be a long way to achieving our goal of helping people to do things actually people doing their bit, which is what you want to say and that you've said in the corporate plan. That's the aim. Yeah.
Can I ask a follow-up quickly? I know Ruth's got her hand up, but I just wondered how being trauma-informed feeds into this work as well, because it's not mentioned specifically in the stuff that you gave us today.
Yes, that's a really good point. And actually, the team did have trauma-informed training quite recently. So yeah, they've had that, and I think absolutely it's really key that that we take a trauma-informed approach to everything we do. And I'm sure that's going to be really important to the team.
Thank you. Ruth, did you want to come in?
I just wanted to very quickly make the point that all those things that Rachel said were absolutely true. But what we do know as well is that communities and individuals that feel that they have a sense of control over their community, they feel part of it, they feel like their community is supporting them and in welcoming them, and that they can do their bit within their community, also have better health and wellbeing outcomes. So you can have equivalent levels of deprivation. So you can still have considerable issues around income and poverty and all of those issues. But if you have that sense of control of your local area and feeling that you can take part in it, do your bit, you're supported in your community, the health and wellbeing outcomes are increased. So given that we can't necessarily eliminate poverty, I know we're working towards that, but we can't at the moment, then this gives people the best chance to have improved health and wellbeing outcomes given the situation that they are living in.
And presumably with the sort of more concerns we have about the cost of living, things that are happening, these become even more important, isn't it? I think to make sure that communities stay together in that respect. Anybody else? Gary, sorry.
It's just a small point just to build on things, but in your presentation, Rachel, you talk about consenting processes being finalised for people sharing their stories. Do you know when that's likely to be? Because I think from my perspective, that's always a really powerful moment, isn't it? When you can get those real human stories out in terms of getting the engagement and the kind of power of that for me is, you know, is incredible. When's that likely?
Yeah, so this is where it's really great that we've got the support of Plymouth University, and I know that obviously the partnership now between Public Health and Plymouth University on the health determinants research will also be a key part of this, that we're building the capacity of the community to understand those things in terms of research, but we've got, so the university are going through the ethics approval process at the moment for the evaluation programme for this piece of work, so that'll be completed shortly. But the issue is that we've got different organisations are doing appreciative inquiry type work, and it's in different ways, and it's kind of everybody's coming together to try and work through how can we share all the information we're gathering between ourselves. So the approval process for the evaluation for this programme is nearly finished, but it's just how do we share stories across different programs. I think that's the piece of work that's taking a bit longer.
Easy questions and not always straightforward answers, but thank you, Rachel.
Thank you. Anybody else? Nope. Rachel, can I thank you very much indeed? As I say, sorry for sort of getting ahead of ourselves. We then had to go and find you from wherever, so sorry. But thank you very much for the presentation. And can I ask the board to note the report, please? And obviously, when there's further updates that you believe you need to bring back, please do. Thank you very much. Right, item 11, folks, is the tracking decisions. And I think we've made progress in all of them, haven't we?
Yes, Chair, thank you. All of them currently marked completed. There's just 3, but some of them broken down into subsections. The workshop on the integrated care strategy, obviously we've completed and submitted comments. There were a number of items added to the work programme last time, warm spaces, cost of living, to be discussed in the next item as to where we want to add those, and the previous ones we've heard. That's all I've got to say.
Thank you. So, it's to note that progress, and then item 12 is the work programme, and it's for the board to suggest items to add to the work programme, and what items are we wanting to bring forward to the next meeting, please. On that next meeting, unfortunately it's been planned for a date that both Councillor Lang and I are off on a course with the LGA, so we will come up with an alternative date which will probably sort of be like a week later or something like that, but we'll let you know ASAP, so that you can get it in your diaries. All right, so work programme. At the moment on this we've got food insecurity, warm spaces and cost of living working group.
Yeah.
And then the carer strategy.
Through you, Chair. I provisionally added those for the next meeting just because they were requested at the last one as work items. So up to the committee which ones of those they want to bring forward. They do link in quite nicely, and I think, was it Anna or Ruth said, we could do a topic on a collection of those, which would tie in nicely. Carer strategy wasn't ready for this meeting, but it's ready to come next time. And then obviously anything else you wish to add.
I think if we look at that food insecurity, warm spaces and cost of living working group, I think that ties in very nicely. I mean, certainly at the moment we're probably not looking at warm spaces, we're probably more looking at cool spaces, but you know, by September going into October, we'll be again having to think about that, and that's going to be linking very much into that cost of living, isn't it? So I think Ruth, I don't know about you, but I think that all ties in very nicely, and certainly from the food insecurity. I mean, that's such a huge topic, but I mean, we know that food banks are under stress now, aren't they, already? So I think your thoughts on whether you'd be ready to bring it all together.
Yes, yes, certainly. I mean, I think probably it just all falls under the title of cost of living, and we'll cover it all within that heading. And obviously, we will have a new cost of living plan will have been published by then, and will be well underway.
Yes, Sue's got 100 days, hasn't she? And that's it. She says, because it's me as well on that group, but you know, I'm going to blame it all on Sue. I think that's the best bet. Tony.
Yeah, without wanting to volunteer myself for anything, Health Watch England have recently done quite a bit of work around cost of living, predominantly how it affects health and mental health well-being. We've done a small part of that for Devon as well, so I think that would link in nicely for September. But if you go a week right, I'm on leave, so I might have to find somebody else to present. Week after would be okay. Yeah.
Great, and I think I get a sneaky feeling Sue takes it to Cabinet in September, doesn't it? So in fact, probably a week later may be a better thing than a week earlier. So, but we'll work on that and let you know if we can let people know within the next week as to what the new date will be, and just double check. Well, before we publish it, we'll check with all of you that it's reasonable. But no, I think that we really welcome, Tony. Thank you. We'll make sure that we liaise with you about that. Anything else anybody's feel is coming out of the woodwork that we would like to add? I think that could be quite a meaty meeting anyway. Chris, anything coming out from you?
So I mean, you've got primary care as one of the other areas on there. We are doing an improvement week in September, so it probably would be perhaps better the following meeting to bring that in. Yeah, and I suppose the other area, maybe we can think about how some of the Better Care Fund work and measuring some of the metrics against that, whether we might want to start bringing some of that into here as well.
Mima.
I was wondering whether you will have had the first meeting of your dental task force by then. I didn't know if we could just have an update, a brief update about how that went and the direction of that.
Well, I'm hoping we'll have maybe even got around to the second sort of follow-up, because we've got the first one next Friday. So I'm certainly hoping that there will be some very active things to come out of that we would then go. So yes, there'll certainly be an update by then. So are we going to start calling it the NHS Dental Task Force rather than just calling it a dental task force? I think it's the NHS bit that's the most important. Well, in my opinion, it's the NHS bit that we'll put that down. Okay. We've also, if we actually look at this, it's the Safer Plymouth and the Plymouth Safeguarding Board. Ruth, is there a sort of, this is going to sound awful, is there an obligation of us to have some report from them? I know it has to get, the Safeguarding Board reports need to go to scrutiny, or there's usually a yearly thing going to scrutiny, but and then I suppose the other thing is the impact on COVID. It's when that's going to be a relevant time to take, isn't it? I mean, I know government at the moment is looking at all the COVID stuff, but it's how do we put that into our agenda, or do we need to at this stage, or is it better to wait and see what comes out from government about future vaccine programmes, etc. for the winter? I don't know. What's your thoughts?
To be honest, I'm not sure what was intended by that item. I don't think I put it on there, so I'm not quite sure what was intended around that. So I mean, I'm happy to do what we can if people know what they want around it. In terms of the inquiry, then no, I think if we're looking at that with a view to what are the key lessons learnt and what do we need to do to prepare for the next pandemic, then I think we should delay that a little. So yes, I'm sorry, I don't quite know the context of why it was put on and whether Livewell asked for that to go on. So I can find out from them. Certainly from my point of view, I don't think there's anything specific I would need to update the Health and Wellbeing Board on around COVID at this point, or in 3 months' time.
Lovely, that would be great if Liv will straighten that out. And looking at the cost of living thing, I mean, I know Citizens Advice, Sue is going to meet with them next week, isn't she? Because Citizens Advice came and gave us a very detailed report, didn't they? Was it this January, or have I lost track of time? And it was certainly in the last the last civic year, wasn't it? We had a very detailed update from them as to how cost of living stuff was affecting their contacts. So it would be good if
Yes.
we're inviting Sue, if we can put that in as well at the same time, an update on Citizens Advice and what the workloads it's causing them, really, isn't it, as well? So that would be good. Okay, does that tie up everything there? Isn't anything else jumping out that you want to think about for? I mean, we've got the January and we've got the March meeting, so I think let's keep it on in our thoughts as to what we'd like to add in. And Laura, if there's anything coming out of university that we'd like, you'd like to make sure that we add in, you're very, very welcome to let us know. And Tony, I mean, the things that come out from Health Watch are always very important. There's still lots going on, isn't there, as far as the health service is concerned at the moment? I mean, University Hospital Plymouth is working, I was going to say it's socks off to try and get things, and we know that the waiting list times are coming down, but they're still having real problems, aren't they, with ambulances having in the car parks and getting that throughput of people through. And I think we need to be mindful that there's work going on there, and that we have to, it's dividing it between us and what goes to scrutiny. And I think that's where I rely on Elliot and Jamie to keep that differentiation, because we should not be duplicating what should be going to scrutiny for them to look at. So I think that's what we need to make sure on that. Okay, well, if anybody thinks of topics that we need to be really, as a health and wellbeing board, I think one of the things that I will be doing, I think, is perhaps that we write around again to our invitees, not so much, obviously, all of you that are here, but I think we need to remind associate members, or whatever we call them, that it is useful to have them at the table to be bringing their points of view forward. So I think that's what's essential. Okay, folks. Well, our timing was a bit off in the beginning, and we're now 10 minutes late anyway for finishing. But so I think we've lived up to normal. So thank you very much indeed for giving us your time this afternoon, and we will no doubt be in touch soon. Okay, take care. Thank you.
So I got the link for the meeting right. I just